Hello, everyone. Welcome to Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Beauty is in the eyes of the beholder. Are you considering changing your appearance? Or enhancing your lips, getting rid of those wrinkles, or a mommy tuck? Well, look no further. Today we're exploring plastic surgery with Dr. Derek Ford and Dr. Stephen Hanna from Ford Plastic Surgery, here to talk about enhancing natural beauty and creating rewarding results. We want to help you learn more, so let's learn together. Dr. Ford and Hanna, welcome to our show.
Thanks, Karen. Thanks very much for having us today.
So great. You guys have been so helpful, especially during COVID. So, Dr. Ford, tell us a little bit about yourself and how your organization came to light.
So our practice has been in existence for about 20 years. Mm-hmm. And so when I first started practice, I opened up an office in Durham and also in Toronto and the Yorkville area. Mm-hmm. We've always been fortunate enough to have our own access to our own private operating facility. That way we can control our time and control the staffing and the whole process of performing surgery. And over the years, our practice has expanded to include 2 operating facilities, 2 other surgeons, a staff that provide non-surgical services in our office, and a staff in the operating room of about 30 people. Yes. So we have offices again here in Durham. So we see our consultations here and in Toronto, but we do our surgeries in Toronto. Yes. And we do surgery every week, usually on Mondays, Thursdays, and Fridays, and see patients on the remaining days in the week.
Great. That's wonderful. Dr. Hanna, tell us about yourself and why did you get into the field?
So I'm a Royal College certified plastic surgeon, and through my training, was always interested in aesthetic surgery. So once I was finished, I ended up moving to New York to work with some of the real legends in our field, pioneers in facial surgery and rhinoplasty, before moving back to home, which is Toronto, to join Dr. Ford. Really excited to be part of the team.
So, Dr. Ford, tell us, because we all are, especially more female, but although I'm realizing, or I'm getting information that men are also doing like things that we do to enhance our beauty. Why should someone get plastic surgery, in your opinion?
Yeah, the goal is really self-care.
Yes.
And over time, especially over the last 20, 30 years, the acceptance of self-care has become greater. We often see men in the office for things like Botox injections to have the face look just a little cleaner. And then that progresses to sometimes some skincare treatments like laser or radiofrequency microneedling, and then sometimes surgery.
Yes.
And so and then really the goal is just to clean things up so people feel more confident at work and socially, and just cleaner, better version of themselves.
Yes, yes. I think if you can enhance something, I'm a strong believer in, if like, not that we're all different in our own ways, right? But if something makes you feel more confident, why not? If technology is there, like, why not? We all want to be our best selves or have our best health. So, Dr. Hanna, I'm going to ask you, in terms of the process of getting plastic surgery, because I know I told my family that my present to myself at 50 is plastic surgery. So how tell us what it's like. How does a patient go about deciding what plastic surgery to get? And is that a process that you do together?
So, absolutely. So I think it starts with the patient. I mean, it's a lifestyle choice, a choice to enhance or restore yourself, and to seek out surgical help with that, or sometimes non-surgical. But I think the relationship between the surgeon and the patient is really important. I think there is a lot of shared decision making, because while the patient may bring concerns to the surgeon may have suggestions for what is possible and what is reasonable to address.
Yes.
Ultimately, the patient's steering the ship, and they come with their own goals, and we do our best to help achieve them.
Yes, yes, yes. So, in terms of what you do, is the process that you work together, or are you set up so you individually do your separate? Do you jointly ever do any type of surgery together?
Sometimes we do, but more often a patient comes to see our practice and comes to see one of the practitioners.
Yes.
And so we all have the specialty training in certain aspects of plastic surgery. So, so if there's something outside the scope of what we usually do or are experts in, then there's someone else in our office that can also see the patient for that aspect that concerns them. Most of the time, we would, as a surgeon, treat one patient. But sometimes if there's another aspect that we're not comfortable with, or if there's another expert in our office, then the patient would see the other practitioner in our facility.
So I'm going to ask both of you if you can tell me, and I'll start with you, Dr. Ford. What is your top 3 favorite surgery you like to do?
So I have subspecialty training in eyelid surgery and facial aesthetic surgery. So I do a lot of eyelid surgery in my practice. I do it every time I walk into the operating room, and I see patients from all over the country for eyelid surgery. And when people have eyelid surgery, they often ask for other surgeries or procedures on the face. So we do a lot of facial surgery, and then we were plastic surgeons. So people often ask, well, while you're doing my facial surgery, I really have this area on my side that's been bothering me for a long time. So sometimes we'll address that at the same time. Now, that's the beauty of being a plastic surgeon. We work all over the body. We're experts at a very specific thing, but we're also trained to do other things elsewhere in the body, and we can often address those at the same time.
Wow. A woman's best friend. Dr. Hanner, can you tell us the top 3 surgeries that you like to do?
Absolutely. I mean, so I enjoy the entire scope of aesthetic surgery, but I think the things that I end up enjoying the most are probably deep plane facelift surgery, rhinoplasty, and I've been doing a lot of fat grafting, both because I enjoy it and because I think patients are starting to move away from fillers.
Yes.
And fat grafting has really been a nice way to add volume or rejuvenate the face using, patient's own fat.
Yes. And what I'm glad you mentioned that. I think I saw something. Just one clarification on that. Normally, the general public concept of breast implants is the silicone and that type of stuff. Do you use fat from other areas to enhance the breasts? You able to?
You absolutely can. This becomes where the shared decision making is important, because fat grafting is appropriate for breast augmentation, but we typically will do it in someone who has a more modest size goal.
Yes.
For patients who really want a large augmentation, or who want a particularly full upper pole of the breast, they may be more appropriate for breast implants. So it ends up being a discussion with the patient about what would make them happy, and we go from there.
So that means that having a reduction in other areas, right?
Yes.
Just to be able to enhance the top areas. Okay, interesting. Because I always say I have the bottom area people pay for, which I don't want touched, but I can work on a couple other areas. Dr. Ford, because we know how society is in terms of how we deal with things emotionally. Do you consider mental health in your practice? And because we know, like, for instance, if you get a tattoo, it's very addictive. So once you start a process, it's like you want to do more. You see different things. Do you consider the mental health of your patients? Or is there a conversation, or how do you balance that as a surgeon?
So, very good question. And so it's all about realistic expectations and goals.
Yes.
And so the internet has colored what realistic is. And so when we see patients, we listen a lot during the consultation, and we try to define what that goal is. And so the goal should always be a safe goal and a realistic goal. And the goal is also not to change your identity.
Yes.
So there are certain requests that are made by patients and that aren't safe,
Yes.
or have another purpose to please someone else, and sometimes those aren't the best goals to have. So we're very clear during the consultation what is safe,
Yes.
and what we can do and what we can't do, and what the
Yes.
limits of what we can do are. And so we try to direct our patients that way. If a patient's not a good candidate and if the goals don't align with what we can do, then
Yes.
we're very clear that that's not the case.
And that is so important, because sometimes, like, I used to be a trustee at Lakeridge. I used to be responsible for quality care, and one of the hardest things was going through COVID and responsible for quality care. But you get to see things from a different perspective, in terms of how the public sees things and how the doctors work, and the talent that I've seen in terms of doctors who are really passionate and dedicated to the work they're doing is just incredible. I have to ask you this question. It goes back to social media, because I saw something. I don't know if it's true or not, but I saw something that, and I didn't know that men are doing this, but I saw something in terms of, I think someone said that Drake had his stomach done, and then there's another person on, everyone looks at social media, that actually went from having a 1-pack to an 8-pack. Like, oh my God, like, what are you guys doing in plastic surgery? That is, I mean, you don't have to work out, you don't have to do this, but what type of surgeries are men actually get into? And it's only fair for them,
Yeah.
you know, but what kind of surgeries are men doing?
So that's a great point. So liposuction is very common in
Yes.
men, and so you mentioned more definition in the abdomen. So in recent years, there's been developments in liposuction, something called high definition liposuction, where you liposuction a little bit more in certain areas and a little bit less in other areas to enhance highlights, especially when you have lighting in certain ways, to create a more athletic appearance to the frame. So liposuction is very common. Eyelid surgery is super common in men as well, and things like rhinoplasty. But I would say probably the most common is liposuction, and more and more so operations on the face. And
Yes.
I think men sometimes, when as they age and are in a competitive workspace, find that they really need to be as presentable as they can and be confident. And that brings a little bit more confidence to their workplace.
I want to ask you this, because when I worked as a designer, I couldn't say who my clients are, even though I had high-profile clients. But in the world of social media and television, you see Hollywood, right? And it's like, do you find that almost everyone gets surgery, or do you think, is that like, are we like imagine that everyone, because everyone seems perfect, right? You know? And so are you finding that public figures more are getting more have a I don't find anything wrong with it. I strongly believe that if something makes you feel comfortable or you want yourself to be a certain way, it's all about how you feeling, right? As long as you do it for you, right? Do you find it's realistic what we're seeing? Because we also have young girls who are watching what's happening, and you know, I mean, once you get at a certain age, right? I think it's a wonderful idea, but do you find it's realistic in terms of reality?
I think the best plastic surgery is the plastic surgery that no one knows that you've had surgery.
Yes, yes.
And I think it's realistic to have, again, self-maintenance and try to be the best that you can. And as we age, that's one of the tools that we have to maintain that confidence and presentability.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome back to Health 180 with Carion Fenn and Rogers TV. Dr. Ford and Dr. Hannah are back with me from Ford Plastic Surgery. It's been a very interesting conversation. I'm learning a lot, not just for myself, but I think viewers are going to really enjoy the content and what you guys do. Dr. Ford, tell us, what is the most requested plastic surgery at your facility?
We do a lot of facial surgery and as well breast and body surgery. So it really depends on who you see at our practice. Dr. Hannah and I do a lot of breast surgery, Sorry, I apologize. We do a lot of facial surgery. I apologize. Dr. Laura Snow, who's not here, she's an expert in breast surgery.
Yes.
And both Dr. Hannah and I and Dr. Snell do body contouring surgery as well. Things like tummy tucks and liposuction.
Yeah.
The most common facial surgery that we do is likely eyelid surgery, facelifts, and rhinoplasty.
Who does the most eyelid surgery? That's your expertise?
I do, yes.
Okay. So, Dr. Hannah, how do you balance changing someone's image without actually changing their overall face? Because sometimes we see in the media, someone can start off being, very natural and beautiful, and then they goes to another extent, but then again, how they were before was actually better when they first started. So how do you balance that as a surgeon?
Absolutely. I mean, so we certainly see some of those cases, and we're all familiar with them.
Yes.
I think a lot of this starts with understanding the patient's goals clearly and making sure, in our practice, we tend to focus on a very natural aesthetic and a natural change. So our goal is to take the person back to what they looked like a decade ago, 15 years ago, not to change the identity. And so that often, the things that go into that are procedure selection and the extent to which you perform those procedures. So if you're doing a facelift, in our hands, we'll do a deep plane facelift and not pull on the skin quite so much to give people that really tight sort of wind tunnel look. We'll do some fat grafting to address things like atrophy of the face, to rejuvenate, not to make the face look too big. We might do a brow lift to lift the brow subtly, but not to pull the brow way up high. And so it's a combination of procedure selection and the extent to which those procedures are performed, and then there is an artistic side to it. I mean, I think we all choose to go into aesthetic surgery for the creative aspect, and I think that's really what goes into it.
Do you find, and either one of you can answer this question, because I've noticed, like, over the years, before I didn't like to smile a lot, so you wouldn't see me smile a lot, and now that I'm more mature, right, I do see my smile, and I'm like, whoa, where was this smile before, right? So do we find that we discover more the best part of our bodies, or do we, like, from growing up, right, maturing into yourself, is there a transition where like certain part of your body enhance more naturally, or do you find that in terms of the different areas that stands out, is that something that grows according to age, or do you find that, should you do plastic surgery at an earlier stage or a later stage in life?
I think it depends a lot on what sort of surgery we're talking about, because every piece of the body is a little bit different, and how concerned someone is. Certainly we hope that all of our patients love their bodies before and after the procedure, and that we're just facilitating that. But some surgeries are performed earlier than others. For example, patients may have children and then have some sagging of the breast, and so we may do a breast lift, or they may have some redundant skin on the abdomen, maybe some loose muscles, so we'll do a tummy tuck. That tends to be done earlier in life, but then that same patient may come back later as they notice their face starts to age, and then we'll start to perform facial rejuvenation procedures. Something like rhinoplasty, this isn't really an age-related thing, but that often is performed younger because patients, they tend to notice it when they're younger. So it really depends on the type of surgery, I would say.
I'm sure a lot of people be interested in this aspect. Tell us about mommy surgery. How popular is that as well?
So
what is for those who may not know, what is mommy surgery?
Great question. I think that, so what it is sort of poorly defined, because it's a real Instagram term, mommy makeover, and maybe we need a new term too, because mommies don't need to be made over. If they did an awesome thing, and that needs to be respected. But I think what people are referring to when we talk about mommy makeover surgery is often a combination of tummy tuck surgery or abdominoplasty and breast lift surgery or mastopexy. Sometimes people may have some liposuction at the same time. That may involve some fat grafting as well, but usually it's a combination of breast and body surgery. and it is quite common because a lot of the changes are related to pregnancy, and many women notice that after pregnancy.
So in terms of a tummy tuck, what do you really do? Are you just removing fat and tightening the skin? What do you do in terms of a tummy tuck?
Yeah, so tummy tuck surgery is different than just removing fat. We typically would do liposuction to remove fat. And that's done through several small incisions, and then we suction the fat out, so it helps to achieve a nicer contour to the body. Tummy tuck surgery involves making an incision hidden, quite low on the body, and removing the extra skin that has been stretched out, often by a pregnancy or by weight gain.
Yeah.
It also involves a muscle repair. So when someone gets pregnant or when they're quite heavy, the abdominal muscles can become stretched. And the only way to repair those is to do it surgically, to lift the skin up, and then we call it plication. We'll repair the muscles in the midline of the body to give the person that sort of a natural corset of the abdomen. Then we'll remove the extra skin and put it all together.
Is it possible to get rid of and I think a lot of mothers, in terms of not everyone is lucky enough not to get like stretch marks, right? How do you deal with in terms of stretch marks? Is that something that you will always have, or is there something that you can do to lessen the stretch mark that you get from birth?
The short answer is that stretch marks are an extremely difficult problem, and they're sort of one of the final frontiers in aesthetic surgery. But there is a more nuanced answer in that some stretch marks are low on the abdomen, so they don't come all the way up.
Yes.
And so with a tummy tuck, we can often cut out the stretch marks.
Okay.
But we don't have any sort of really reliably effective cream or non-surgical treatment. We've had some mixed success with radiofrequency microneedling, and it can help with texture. But it's if someone is looking for a complete removal of the stretch marks, I think we're still working on that as a field.
So I heard this, and again, social media, they play a big role in our lives in terms of the belly button. Like, how do you maintain the same belly button? Is that like a reposition in it? Like, how do you take away like skin and still remain a belly button? Is there a different? Okay? So I heard that there's such thing as like a tummy tuck belly button. Is it the same belly button that you're using, or are you making like a new belly button?
In a lot of cases, it's the same belly button. I would say in most cases, it's the same belly button. But that's the magic of plastic surgery. We save that belly button and we bring it through the skin that we're bringing down. So what it is we do the tummy tuck. We remove the skin often around the belly button and below.
Yes.
And then the skin from up top gets pulled down over the stalk of the belly button.
Yes.
And then we bring the belly button through the skin.
Okay.
In some cases where there are large hernias or there are other issues, we may not keep the original belly button, and we may have to reconstruct the belly button. But that is not common.
So you can make your own belly button.
You can.
Oh wow, miracle.
Designer belly button.
Designer. I like that. Designer belly button. Oh my goodness. Dr. Ford, I want to ask you tell us what is rhinoplasty?
So rhinoplasty is really the reshaping of your nose, and so part of it can be for functional reasons, if your breathing has been impaired, or if you've had an injury causing that, or even just born with a breathing concern.
Yes.
And then changing the shape of your nose, which can influence the balance or harmony of your entire face. So the most common reasons people seek rhinoplasty is because of a bump on the top of their nose. And then probably the second most common reason is because of the shape of the tip.
Yes.
So sometimes the tip can be a little bit wider, a little bit fuller. The nose can be wider as well. So it's really reshaping that to establish a better harmony to the face. And usually, like Dr. Hannah mentioned, usually we see requests for this operation in younger patients, but also later on in life. But usually most patients are younger for that procedure.
So is it mostly reduction? You mentioned like reshaping.
Yeah.
Is it mostly reduction of the size of your nose?
Recontouring, so reduction sometimes in the top of your nose. So if you look from the side, sometimes there's a bit of a bump here, or sometimes the cartilage in the nose isn't maybe shaped as as a slim way as would bring better harmony to the nose. So sometimes we reshape or excise some of the cartilage and sew the cartilage together to get a better, slimmer shape.
So, in terms of, you're not touching bones, are you? When you?
Yeah, we are. So that's a really good point. So, so the nose is about a quarter to a third bone, and it comes down from your forehead, and then the remainder of the nose, 2/3 of it is cartilage. So so often we need to break the nose from the inside to blend into the cartilaginous changes that we make.
Yeah. That's why it's so important to get a doctor that knows what they're doing, because you don't want something bad to happen. Dr. Hannah, tell us about. I have to ask you this because I've seen, no offense to any of my friends who's watching, I'm not talking about you, but we've noticed in COVID, like quite a few people that I've interacted with that were young and beautiful. When COVID happened, their faces change. Tell us about Botox and fillers, because I think having a plastic or someone like yourself during COVID would have been very helpful for a lot of people. Tell us about Botox and fillers.
It's certainly something people missed during the pandemic. Yes. So Botox and fillers are non-surgical ways that we can help with facial rejuvenation or prejuvenation, preventing aging.
Yes.
Botox works different from fillers. They're both injectable things, but Botox, or botulinum toxin, Botox is the brand name. Botox works by relaxing muscles, essentially. And so the goal is to relax muscles that cause creases in the face. So there are muscles that go opposite the direction of the wrinkles, like if you look at my forehead.
Yeah.
We try to relax those forehead muscles to prevent the wrinkles from occurring, or to treat them in people who have deep wrinkles already.
Yes.
So you hear that sometimes people are getting it when they're younger to try to decrease the prominence of those wrinkles and keep them sort of not visible as they age. Fillers are a different injectable product. The fillers that we use in our office are all dissolvable fillers, so they're all hyaluronic acid fillers, which is a naturally occurring substance in the skin.
Yes.
There are non-dissolvable fillers, but I think we both prefer that I think we both prefer the dissolvable fillers because the risk profile is a little bit better. What fillers do essentially is occupy space, and so in areas where you may want to augment, say, the lips, we can add volume with fillers through an injection.
Yes.
And in areas that may have lost volume over time, like, say, the temples or under the eyes, we do a lot of eye surgery in the office. We get a lot of requests for under eye filler. We can add volume to try to replace what's missing and hide some shadow.
Yes. You're watching Health 180 with Carion Fenn. Thank you to Dr. Ford and Dr. Hannah for joining me today. My name is Carion Fenn, and thank you for joining. And remember, together we're stronger.